Performing the GCS assessment: eye-opening, verbal, and motor response. Always commence the neurological observations by informing the patient of the process and obtaining their consent if they are conscious. In the OSCE, even if you have a patient with a neurological injury, they will usually be responsive. In normal clinical practice, if you have a non-responsive patient, you would proceed even without consent because it is in the best interests of the patient. If a patient is becoming disoriented, they could be confused about time, place, or person. Therefore, you may need to help orient the patient again by gaining their attention, speaking clearly, addressing them directly, and providing support and reassurance. Remember, a hospital environment may not include the typical cues an individual would use to help orient themselves. After you have completed these orienting processes, you can begin your formal neurological observations. We start the observations at the top of the GCS chart. As you approach the patient to commence the observation initially, you should have noted whether they opened their eyes. If they opened their eyes as you walked into the assessment bay, spontaneous eye opening should be recorded. If they opened their eyes in response to you speaking, to sound should be recorded. If the patient doesn't respond initially to you, you should clearly ask them to open their eyes and, if necessary, raise your voice to them. If the patient does not respond to sound, then a physical stimulus should be applied. The physical stimulus applied should be chosen according to whether you are trying to elicit a central response or a peripheral response. It is useful to start with a peripheral stimulus, such as squeezing the side of the patient's finger. If the patient responds to this, mark a dot for pressure on the GCS. If the patient provides no response, mark a dot for none. Remember, factors such as localized swelling may mean that the patient cannot open their eyes. In this case, mark a dot for NT, non-testable, on the GCS, or C if the eyes are closed for swelling. When conducting your assessment, it is important to understand how oriented the patient is to their surroundings, as this can be an indicator of neurological damage. As part of your initial introductions at the assessment station for a neuro patient, you should have already asked them some orienting questions. If the patient does not respond to sound, then a physical stimulus should be applied. The physical stimulus applied should be chosen according to whether you are trying to elicit a central response or a peripheral response. It is usual to start with a peripheral stimulus, such as the squeezing of the side of the patient's finger. If the patient responds to this, mark a dot for pressure on the GCS. If the patient provides no response, mark a dot for none. Remember, factors such as localized swelling may mean that the patient cannot open their eyes. In this case, mark a dot for NT, non-testable, on the GCS, or C if the eyes are closed for swelling. When conducting your assessment, it is important to understand how oriented the patient is to their surroundings, as this can be an indicator of neurological damage. As part of your initial introductions at the assessment station for a neuro patient, you should have already asked them some orienting questions. If the patient answered all of these questions correctly, mark a dot against oriented. However, if the patient was confused when you asked these questions, then place a dot in the confused box. If the patient doesn't respond but utters individual words, then words should be recorded on the GCS. If the patient only moans and groans with no understandable words, mark sounds on the GCS. If the patient makes no sounds at all, their response should be marked as none. Remember, speech may not be testable for other reasons, such as an endotracheal tube. In this scenario, mark not testable on the GCS scorecard. To assess the motor component of the GCS, you need to ask the patient to complete a two-step action, such as squeezing and releasing your fingers and sticking out their tongue. It's important to note that you ask the patient to do the second command and stick their tongue out, because in some instances a patient may not be able to move their arms, for example in the case of a spinal injury. If the patient does as you say and follows your instructions, you should mark Obey Commands on the GCS. If you have a patient who does not respond to your commands, which is not likely in the OSCE, it is likely that the peripheral stimulus you applied previously of squeezing the side of their fingers was not enough to generate a good response, and therefore a central stimulus should now be applied. You can do this first by performing the trapezius pinch and then applying a pressure to the supraorbital notch unless there are injuries in those areas. You would not apply the trapezius pinch if there was a risk of a spinal injury, or apply pressure to the supraorbital notch if the patient had glaucoma. If the patient moves their arm to where your hand is to try and move your hand away, this is known as localizing and should be recorded as this on the GCS. If the arm moves but does not reach the shoulder, the patient is either normally or abnormally flexing. Normal flexion is when the elbow bends and the arm moves quickly away from the body in response to the stimulus. Abnormal flexion is when the body flexes involuntarily in response to pain. If in doubt, record normal flexion. Abnormal flexion can either be decorticate or decerebrate. Decorticate is when the plantar are fixed, legs are internally rotated, and arms are flexed across the chest. Decerebrate posturing is when the patient still has flexed plantar, but the arms are pronated and extended next to the body. If the patient is decerebrate, then you should mark extension on the GCS. The patient should not be recorded as not having a response until the maximum pressure has been applied. If the patient cannot move due to other factors, such as medically prescribed drugs, mark non-testable. Ensure all your observations are accurately reported immediately, so trends can be identified and treatment escalated if necessary. Do not be influenced by any previous observations that may be partially completed on the GCS that you have been given. It may be that your examiners are trying to test you.